Good afternoon. My name is Brittany Smith, and I'm an Auburn University nurse practitioner student. And today I would like to talk to you guys about atrial fibrillation, better known as Afib. I will discuss ways to recognize this clinical diagnosis, treatment options, and teaching components that can be directed towards your patient. Afib can be defined as a paroxysmal or continuous supraventricular tachyarrhythmia. It is characterized by rapid, uncoordinated atrial electrical activity and an irregular ventricular response. Risk factors for AFib includes age, obesity, pericardial inflammation, family history of AFib, the presence of hypertension, diabetes, congestive heart failure, obstructive sleep apnea, and or the presence of a serious illness or infection. If you suspect that your patient has AFib, you should ask key questions such as, have you had the feeling of your heart racing or skipping a beat? Have you had the feeling of shortness of breath, lightheadedness, fatigue? Have you had any chest pain or discomfort? If your patient is suffering from AFib, he or she will answer yes to having palpitations, shortness of breath, fatigue, dizziness, or chest pain. These clinical manifestations usually occur because the heart's two upper chambers, called the atria, are beating chaotically and irregularly. Consequently, this leaves your patient feeling very exhausted. A physical examination component of AFib includes cardiovascular. You would auscultate the heart and hear a very fast, irregular heartbeat. Sometimes you may even think you're hearing an extra heart sound because of the presence of the irregular heart rhythm. In addition to cardiovascular, you would perform a radial pulse check. AFib usually presents with an irregular pulse, and beats may vary in strength. Moreover, you will auscultate the lungs and observe the rate, rhythm, depth, and breathing pattern of your patient. It is important to note that the gold standard to diagnose AFib is obtaining an EKG on your patient. If your patient has AFib, the EKG will read atrial fibrillation. Treatment options for AFib includes anticoagulation therapy. Patients can be prescribed oral anticoagulants such as Xarelto, Eliquis, warfarin, or Pradaxa. These medications can thin the blood to prevent the development of blood clots and or a stroke, which are associated with AFib. Furthermore, a patient may have a cardioversion, which is a procedure where an electrical shock is delivered to the patient's heart. Ideally, the electrical shock converts the patient from AFib to normal sinus rhythm. A patient can also be prescribed antiarrhythmic medications. These medications help restore the heart back to normal sinus rhythm. Some antiarrhythmic drugs to treat AFib are called amiodarone, Multaq, or Sotalol. Ideally, these medications will control both heart rate and rhythm. Some priority teaching components for AFib patients are educating the patient and family on the definition of AFib, risk factors for AFib, and answering any of their questions or concerns related to AFib. You also want to explain the importance of taking medications as prescribed, especially the blood thinner medications. The patient should not stop taking blood thinner medications for any reason unless their healthcare provider advises them to do so. Furthermore, you want to teach the patient and family regarding signs and symptoms of a stroke, such as drooping of the face, slurred speech, loss of coordination, or sudden onset of confusion. If you should suspect that your family member is having a stroke, you should call 911 immediately.